welcome to a special course on protecting yourself from COVID-19 and the workplace. I'm Dr. Pervez Ahmed. This is the third lectures of our special lecture series. And these particular lectures, we will have a discussions on the key exposure factors and the workplace. And then we will discuss about the high, medium, and low potentials for the exposure. So let's start today's lecture. So, in the first place, we will have a discussions on the key exposure factor and the workplace. Uh, so, in order to do that, we have to ask a certain questions. At first, we have to ask ourselves: does the work setting require close contact with the people potentially infected with the COVID-19 virus? Do specific job duties require close, repeated, or extend in contact with the people with the known or suspected COVID-19s? Has the community spread up the virus included cases and the workplace? So, just on based on the particular question we asked, we have categorized, the potentials and to high, medium, and low. So, first of all, we will do the discussion on high potentials for the exposures. So, high exposure risk occupations are those working with the people with the known or suspected COVID-19s, especially while performing aerosol generating procedures. So example of board settings are healthcare, laboratories, orthopedic suits. Example of the job activities included bronchoscopy, sputum inductions, working with the specimens and the laboratories, some dental procedures, some autopsy procedures. So high potentials for exposures. Example of work settings include hospital and other type of the healthcare facilities, medical transport, uh, correctional facilities, drug treatment centers, homeless shelters, home health care, environmental cleanup of SARS-CoV-2, correctional facilities, long-term and residential care facilities. Example of job activities included direct patient or long-term resident care, emergency medical services, housekeeping and maintenance and the patients and resident areas. So these are the high potential for the exposure. Example of board setting and example of the job activities. And it also include example of job activities also include meat picking. So now we come towards the medium potentials for the exposure. So the example of the work setting for medium potential for the exposure include retail stores, public transportations, home visiting occupations, postal and warehouse workers, public services. Example of the job activities include stocking shelves, checking out customers, emergency home repairs, handling mails and goods, processing public benefits. Low potential for the exposures include this is the category which consists especially for the people with the occupations, particularly those that do not require contact with the people known to be infected nor frequent and contact with the public. I mean the lowest the potential is found in the people who are neither in close contact with the other people who are infected or expected. So these are being the main categories which has the potential for the exposure, and accordingly we have characterized them in low, high, and medium potentials for the exposure. So in coming lectures, we will deal with the healthcare settings, long-term nursing and residential care, emergency services, healthcare facilities, identification and isolations, and role of public health care official. So stay tuned with our lecture series. So till then, bye bye.